This is the area of the room. Okay.
Okay, so I'm going to check the chart. I'm going to walk in. I'm going to provide privacy. I'm going to wash my hands. Hello, my name is Madison, and I'm going to be your nurse today. How are you?
Good, how are you?
I'm good. Can you tell me your name and date of birth, please?
02/20/1998, Dominic Brand.
All right, and do you have any pain right now?
No, ma'am.
What brings you in today?
Annual checkup.
All right, so first we're going to start with your skin and hair. While feeling the hair, it is thick, right for ethnicity. It's dry. While looking at your face, I don't notice any lesions or masses. Skin color is right for ethnicity. I don't notice any skin discoloration. The hair on your face is evenly distributed. Have you had any skin problems before?
No, ma'am.
All right, and do you have any concerns right now?
No.
Okay, I don't notice any freckles or moles on the face. I do notice one right here. Have you gotten that checked out before?
No.
So you don't have any concern with it?
No.
All right, perfect. Now we're going to move on to the neck. Go ahead and put your head back for me. And I'm just going to check your carotid artery. Just breathe in and breathe out. All right, I would say that's a 2+. Go ahead, breathe in, breathe out. And that's a 2+. So while checking the carotid arteries, I would say it's a 2+ and it's equal bilaterally. And now I am going to feel under the jaw, midway, and at the base of the neck, using the bell side of my stethoscope. Each time I place my stethoscope down, I'm going to have you breathe in, breathe out. This is under the jaw, midway down, at the base of the neck. All right, while checking your carotid arteries, I didn't notice any bruise. And now I'm going to have you get up and sit on this couch for me. Go ahead, lay down. Did you have any pain while doing that?
No, ma'am.
All right, so right now my patient, I did not notice any JVD, but if I did notice JVD, I would have my patient sit up at 45-degree angle and note any findings that I found. Go ahead and get up and sit back on the stool for me. All right, and now we are going to move on to the anterior chest. Do you have any chest pain?
No.
Have you had any chest pain?
No.
Have you ever been seen by a doctor for anything chest related?
No.
Okay, perfect. I am going to find your lung field. It's going to be from here. Go ahead, sit up for me. And it's going to be under the 5th rib. So this is going to be the lung field I'm going to be assessing today. All right, first I'm going to find this right here is the sternal notch. I'm going to go down over the angle of Lily. I'm going to come over here. This is the aortic right sternal border, second intercostal space. I'm going to come over here to the pulmonic left sternal border, second intercostal space. I'm going to go down one to Erb's point. This is going to be the left sternal border, third intercostal space. I'm going to go down two to the tricuspid. This is going to be the left sternal border, fifth intercostal space. And I'm just going to go right under here. And this is going to be the mitral midclavicular line, fifth intercostal space. And also while I'm right here, go ahead and sit up for me. This is also where I will note the PMI and apical pulse. But today I'm just going to inspect, and I don't notice any heaves or lifts while inspecting that area. Do you have any questions for me?
No, ma'am.
All right, and did you have any pain at all while sitting up?
No, not at all.
All right, now I'm just going to put my stethoscope down. Just breathe normally, and I'm just going to hear the heartbeat, okay? Okay, so while listening to the heartbeats S1 and S2, the rate and rhythm is regular. I don't hear any murmurs or any extra sounds. And now I'm going to follow IPPA. So first I'm going to inspect While looking at the chest area, the hair is distributed evenly. I don't see any type of discoloration. The color of the chest is right for ethnicity. And now I'm going to have you sit up for me. All right. And now I'm just going to palpate. Did you feel any pain? All right. And now I'm going to percuss your entire lung field, okay? All right, go ahead, lift your arm up for me. I'm going to come over here. All right, and did you feel any pain at all?
No, not at all.
All right, and now I'm just going to listen. So now each time I put my stethoscope down, I'm going to have you take a nice big breath in and then let it out, okay? Go ahead, lift your arm up for me. All right, we're going to do this side. All right, so while listening to your lungs feel, I didn't hear any bronchi, crackling, or wheezing. Do you have any questions for me?
No, ma'am.
All right, did you have any trouble with breathing in and breathing out that many times?
Not at all.
All right, perfect. So now we are going to move to the posterior part of the chest. I'm just going to, can you turn around for me? All right, so here we have the AP diameter. It's a 1:2 ratio. Here is going to be C7. Go ahead, lift your elbow back for me. And underneath the clavicle, which is right here, it's kind of hard to tell on him, but it's right here. That's going to be T7. And now I'm going to go down 3 intercostal spaces. So it's going to be T8, T9, T10. So that from right here to here, we're going to say is his lung fill. All right, and I'm just going to, you can go ahead and relax your arm. Just going to do this. I don't feel any crepitus. Do you have any pain while I'm doing that?
No.
All right, and I'm just going to do a little pinch right here. And I'm going to have you take a nice big breath in and let it out. One more time. All right, so your lungs expanded the way they should have. And now I'm going to do the tactile fremetis. And each time I do this, he's going to say 99.
99. 99. 99. 99. 99.
All right, so while doing tactile fremetis, the vibrations did diminish as I got lower. All right, I'm just going to palpate. I don't feel any masses or lesions while palpating. And then while inspecting the back, skin is warm and dry, pink undertones. I do see a few moles. Have you ever had any concerns with the moles on your back?
No.
No? Okay. Have you ever seen a dermatologist or anything?
No.
Okay. And now we are going to, I'm just going to palpate your lung field, okay? Perfect. Did that hurt at all?
Not at all.
Alright, so the skin color for the back is right for ethnicity. I don't notice any type of discoloration, so that is good. And now I am just going to place my stethoscope on your back. And each time I place my stethoscope, I'm going to have you breathe. Take a nice big breath in and let it out, okay? I'm just going to listen to your lung field. And then one more time over here. Alright, so while listening to the lung fields, I didn't hear any rhonchi, crackling, or wheezing. Did you have any problems breathing in and out while I was listening to your posterior chest?
Not at all.
Alright, perfect. We're just going to have you turn around for me. Alright, and now we're going to move on to your upper and lower extremities. I'm going to take your time. You're warm, but nothing to be concerned with, and I'm also going to check your skin turgor. Perfect. It refilled within 3 seconds, so that is good. Go ahead and stick your arms out for me. Alright, so your arms are equal. Any pain while feeling your bony prominences?
No.
Alright, and I don't notice any type of edema or swelling anywhere. I do notice that patient does have tattoos. How long have you had them for?
About 2 to 3 years.
Alright, and have you ever had an infection from it?
No.
Alright, that's good. And I'm just going to check your brachial pulse. I would say that's a 2+. I would say that's a 2+ as well, and I'm just going to check them both together. Alright, I would say that's a 2+, and they're both rated equal bilaterally. And I'm just going to check your radial. Go ahead and put your hand like that. I would say that's a 2+. I'm just going to touch them together. Alright, I would say they're 2+ equal bilaterally. Go ahead and stick your hands out for me. And I'm just going to check your cap refills, okay? Alright, so while assessing the cap refills, they refill within less than 3 seconds, so that is good. That is what I was looking for. And I'm going to do this. Go ahead, squeeze my fingers. Alright, so I feel equal strength in both, and I'm going to pull towards me, and you're going to push towards you. Alright, and I'm going to push towards you, and you're going to pull, okay? Alright, so your upper strength is intact. And while looking at the arms, I see that the hair is distributed evenly. It's kind of hard to tell the hair on the arms because he has tattoos. And I'm just going to have you stretch your legs out for me. Alright, I noticed that patient has hair on the legs. Hair is distributed evenly. And I'm just going to take off your socks. Do you feel any pain while touching the bony prominences?
Not at all.
Okay. And I don't notice any edema or swelling. And I'm just going to have you lift your legs up, and I'm just going to check the cap refills in your toes. Alright, so the cap refilled within less than 3 seconds, so that's good, and that is what I was looking for. And I'm just going to try to find the popliteal on the back of the leg. Alright, I would rate them both a 2+ and that they are equal bilaterally. And I'm also going to do the dorsal pedis on top of the foot. This one's kind of hard to find. All right, I'll rate them both a 2+ and that they are equal bilateral. And I'm also going to do the posterior tibial. All right, I would rate them a 2+ and that they are equal bilaterally. And I would also look for the femoral pulse. All right, I'm just going to have you lift your legs up. I'm going to try to push down and you're going to resist. Perfect. And I'm going to have you push against me. And I'm going to have you pull. All right, perfect. So while looking at the arms and legs, skin color is right for ethnicity. Both arms and legs are dry. And then I'm also going to do the sharp dull test. So I'm going to, when you feel this, sharp, that, soft, go ahead, close your eyes for me. And when I do it on your foot, you can relax your feet. Just tell me which foot I get it on, and whether it's soft or sharp.
Sharp.
Which foot?
Left. Sharp. Right. Soft right. Soft left.
All right. So your sensation is intact in your feet. Your both upper and lower extremity were intact. You can open your eyes. Your integrity was intact. So throughout this assessment, your skin was evenly distributed. Your skin was warm and dry, and throughout body, I didn't notice any type of discoloration or any type of problems. Did you have any questions for me?
No, ma'am.
All right. Well, thank you for letting me do this assessment, and we are done today.